Anal fissure. Definition. An anal fissure is a tear in the lining of the lower rectum, anal canal, that causes pain during bowel movements. Anal fissures don't lead to more serious problems. An anal fissure is a small tear in the thin, moist tissue, mucosa, that lines the anus. An anal fissure may occur when passing hard or large stools during a bowel movement. Anal fissures typically cause pain and bleeding with bowel movements. An anal fissure is a tear in the lining of the anus or anal canal. The fissure can be painful and may bleed. Types. Anal fissure may be classed based on duration of healing. Acute anal fissure, which clears up within 6 weeks. This is the most common type, and normally appears as linear with clear edges. Chronic anal fissure, which persists for more than 6 weeks. Chronic anal fissure healing time varies. Without treatment, it is possible to have an anal fissure for years. A chronic fissure is usually deeper than an acute anal fissure and is often associated with an external skin tag. Chronic fissure is usually treatable, but recurrence of the fissure after treatment is common. An anal fissure may also be classed based on cause. Primary, due to local trauma, such as constipation, vaginal delivery of a baby or anal sex. Secondary, due to an underlying condition process, such as ulcerative colitis, Crohn's disease or chlamydia. Risk factors. Factors that may increase risk of developing an anal fissure include straining during bowel movements and passing hard stools increase the risk of tearing. Anal fissures are more common in women after they give birth. Crohn's disease. This inflammatory bowel disease causes chronic inflammation of the intestinal tract, which may make the lining of the anal canal more vulnerable to tearing. Anal intercourse. Anal fissures can occur at any age but are more common in infants and middle-aged adults. Causes. Anal fissures can be caused by trauma to the anus and anal canal. The trauma can be caused by one or more of the following: chronic, long-term, constipation, straining to have a bowel movement, especially if the stool is large, hard and/or dry, prolonged diarrhea, anal sex, anal stretching, insertion of foreign objects into the anus. Causes other than trauma include long-standing poor bowel habits, overly tight or spastic anal sphincter muscles, muscles that control the closing of the anus, scarring in the anorectal area, an underlying medical problem, such as Crohn's disease and ulcerative colitis, types of inflammatory bowel disease, anal cancer, leukemia, infectious diseases, such as tuberculosis, and sexually transmitted diseases, such as syphilis, gonorrhea, chlamydia, chancroid, HIV. Decreased blood flow to the anorectal area. Anal fissures are also common in young infants and in women after childbirth. Pathophysiology. Signs and symptoms. Pain during, and even hours after, a bowel movement. Constipation. Blood on the outside surface of the stool. Blood on toilet tissue or wipes. A visible crack or tear in the anus or anal canal. Burning and itching that may be painful. Discomfort when urinating, frequent urination, or inability to urinate. Foul-smelling discharge. Diagnosis. History taking a thorough medical, surgical, dietary, occupational, socio-economical history with the present history of sign and symptoms. Physical exam. It includes a gentle inspection of the anal region. An acute anal fissure looks like a fresh tear, somewhat like a paper cut. A chronic anal fissure likely has a deeper tear and may have internal or external fleshy growths. Visual inspection alone is enough for confirming the diagnosis. Anoscopy. An anoscope is a tubular device inserted into the anus to help doctor visualize the rectum and anus. Flexible sigmoidoscopy. The doctor will insert a thin, flexible tube with a tiny video into the bottom portion of colon. This test may be done if client is younger than 50 and have no risk factors for intestinal diseases or colon cancer. Colonoscopy. The doctor will insert a flexible tube into rectum to inspect the entire colon. This test may be done if client is older than age 50 or he has risk factors for colon cancer, signs of other conditions, or other symptoms such as abdominal pain or diarrhea. Management. Medical management. Anal fissure pain relief and other medicines may include topical anesthetics. Creams such as lidocaine hydrochloride, xylocaine, may be helpful for pain relief. Steroid cream or ointment. Topical steroids may be recommended to ease swelling if it is severe. This may help to relieve pain and any itching. Steroids should not be used for more than 1 week at a time to avoid side effects, such as skin thinning or enlarged blood vessels. Painkillers, ibuprofen and paracetamol can help to ease pain. Opioids should be avoided, as this can cause constipation, which may worsen the condition and is potentially addictive. Stool softener. An anal fissure will heal more easily if faeces is kept soft, so that it can pass more easily. Externally applied nitroglycerin, rective, to help increase blood flow to the fissure and promote healing and to help relax the anal sphincter. Nitroglycerin is generally considered the medical treatment of choice when other conservative measures fail. Botulinum toxin type A, Botox, injection, to paralyze the anal sphincter muscle and relax spasms. Blood pressure medications, such as oral nifedipine, Procardia, or diltiazem, cardizem, can help relax the anal sphincter. These medications may be taken by mouth or applied externally and may be used when nitroglycerin is not effective or causes significant side effects. Other general measures that are recommended alongside medicine for anal fissure may include washing the area carefully with water after using the toilet, to avoid irritation and infection. Soap should be avoided as this may cause irritation, and the area should be gently dried. Sitz baths for anal fissure may be recommended as they are thought to soothe and relax the anus muscles, relieving some of the painful internal sphincter muscle spasm. This involves sitting in plain, non-soapy water after defecation. Eating plenty of fiber, such as is found in fruit, vegetables, cereals and wholemeal bread. Drinking plenty of liquids to soften stools. Adults should aim to drink 2 liters or more each day. It is best to avoid alcoholic drinks as they can cause dehydration. Not putting off defecation, which can lead to bigger and harder stools forming, which may exacerbate the problem. Medicated enema solution. Surgical management. If client has a chronic anal fissure that is resistant to other treatments, or if symptoms are severe, the doctor may recommend surgery. Lateral internal sphincterotomy, LIS. It involves cutting a small portion of the anal sphincter muscle to reduce spasm and pain and promote healing. Studies have found that for chronic fissure, surgery is much more effective than any medical treatment. However, surgery has a small risk of causing incontinence. Complications. Chronic anal fissure, the tear fails to heal. Over time, this can cause extensive scar tissue at the site of the fissure. Incontinence. This may result from surgery to treat chronic anal fissure. Anal fistulas, small tunnels formed between the anal canal and surrounding organs, usually other parts of the bowel. Anal stenosis. The anal canal becomes abnormally narrowed either due to spasm of the anal sphincter or contraction of the resultant scar tissue. Prevention. An anal fissure can't always be prevented, but you can reduce risk of getting one by taking the following preventive measures. Keeping the anal area dry. Cleansing the anal area gently with mild soap and warm water. Drinking plenty of fluids, eating fibrous foods, and exercising regularly to avoid constipation. Treating diarrhea immediately. Changing infants' diapers frequently.
So guys, thanks for watching my video. You can like and comment on my video, but don't forget to subscribe my YouTube channel to watch quality content like this. Thank you guys.